evening, viewers. 5 months into India's vaccination program, vaccine hesitancy has taken an extremely different form in our country. Now, this is not to say that we've otherwise not seen people hesitant to take the vaccines or fearful of the vaccines or even believing that these vaccinations will have some really bad effects. But this is a battle against a pandemic, a virus such as COVID. And we need to put in extra efforts to ensure that there is a good amount of awareness amongst people about the COVID vaccines. Let me just give you a few examples to give you an insight into how grave the problem is. Just in the last 2 weeks, we have counted out a dozen instances where the fear of jabs and misunderstanding about the vaccine has led to violent confrontations with the health authorities. I am not just talking about people sitting in their homes in cities saying we don't want to take the vaccine because we don't see the benefit or don't believe in it. I am talking about villagers who are now attacking health officials and workers, abusing them, cursing them, vandalizing the vehicles, running away and hiding from such medical officials. Those who go to vaccinate, to set up camps, or even those who are actually going to spread awareness to dispel the misinformation about COVID vaccines. Let me give you some of these examples. The first one comes in from Uttar Pradesh, where villagers in Barabanki jumped into the river to escape vaccination. Even after an extensive awareness drive by the sub-divisional magistrate, this is the extent of their strong belief that vaccine is so dangerous that they rather just swim across a river. As a result, only 14 people were vaccinated, could be vaccinated. Let me give you another example. Visuals that we got of similar fear from Etawah. Look at that lady hiding. She is literally hiding, taking cover behind a drum so that the health officials don't come and take her to vaccinate her. That is fear. That's not your regular hesitancy that the world talks about. Here's another example. A team of health workers in Maharashtra's Palghar who was sent to spread awareness against COVID in the village were attacked. This team included doctors who were stopped from entering the village and their vehicles were vandalized. Here's another example. This one from Jharkhand. I'm giving you examples from various states now. A team of healthcare workers who had gone to the Kunti village to address misconceptions related to COVID vaccination were attacked. The circle officer told us that numerous attempts to address fear amongst villagers have gone in vain. They believe this will cause deaths. They believe this will cause impotency. They believe this is some grand conspiracy by either the Sarkar or somebody else to render them useless, to target them. And this is now becoming a huge challenge. It is also adding to the already big gap and divide between urban India and rural India. The big metros where vaccination is taking place at a very fast pace, where people are queuing up, where people are also well versed with how to use apps and portals and are accessing technology to get their appointments done. And the rural side, where they're running away, jumping into the river and hiding behind trumps. How do we tackle this? I want to talk about that. Let's say good evening to Mr. Sudesh Verma, spokesperson of the BJP, Satya Prakash, spokesperson for JDU, Anshul Avjit, national spokesperson for the Congress Party, Dr. Abhay Shukla, national co-convener for the Jan Swasth Abhiyan, Poonam Muthreja, public health expert and executive director of the Population Foundation of India, also joining us. Let me start off actually first with Dr. Abhay Shukla. Dr. Shukla, of course, misinformation or strong beliefs that, any of these government programs could be detrimental have existed in the past as well. We've countered this even earlier with our vaccine programs. But to undertake such a large-scale mass immunization program where a large population believes that this is dangerous for them is a big challenge. What can be done?
Yeah, so I think we need to recognize that there are some objective reasons for this hesitancy. Of course, that is getting exaggerated, but there is some, reasons which we have to address and look at carefully. Number one, is there a trust deficit? Is there a trust deficit between public health systems and people, which needs to be bridged? If people have various kinds of experiences in the COVID epidemic where they have not received treatment or other kinds of services to the extent that were required, and there is a kind of a mistrust that has to be overcome by trust building exercises. Number two, communication has to be far more effective, and communication is a very sensitive and very it's a complex skill. It's not just putting up some posters and just giving some very broad kind of generic messages. That is not enough. Each community, a tribal community, a rural community, requires specific attention to the language, to the understandings, to the beliefs, and that kind of outreach communication is weak. It's in fact quite inadequate, and therefore people are not really getting the kind of messaging that is required, and they're getting their messaging from other sources, which is distorted or unscientific, and that is exaggerating their fears rather than actually guiding them in the right direction. Number three, we need to have vaccination ambassadors in each village. The sarpanch, the asha, the Anganwadi worker, and other social organizations, community groups, women's groups, they have to be brought on board very strongly. They have to be made partners in this exercise. And if this, and so if these more socially sensitive and active groups, many people, they take the vaccination and they say in their village, look, I took the vaccination, I have not had any problem, and you can also take it. It is safe. I took it 3 months back. I am fine. I have also I'm motivated. My family members have taken it. So that is what works. People get convinced when they see real life examples close to them. And for that, a much stronger partnership between governments and civil society organizations of all kinds is the need of the hour. It's absolutely necessary in the COVID situation, and I think that has somewhere not been really attempted in the way that was required. So the trust deficit, and then combined with that of the vaccine shortages, which are of course across the board, the problems with the COVID app, which have led to access issues in rural areas and tribal areas where people are not able to negotiate that complex app, and lack of adequate outreach also to certain extent. So all of these factors have contributed to the current situation. There is a trust deficit. There is a gap between the health system and people in rural and tribal areas. Much more proactive efforts have to be made through partnerships, through a much more effective communication, through much greater participation of civil society organizations in the entire process, and local people, panchayats, women's groups, and so on. That is the way that we can overcome this. Public health is based on trust.
Yes.
Trust is central to public health.
Yes, absolutely. And that is what is perhaps lacking. When you don't trust the person who's coming in, you don't even want to give them time to listen to them, and you do what you can to chase them away. Ms. Pura Mutreja, to you this question then. When those who are even going to spread awareness are attacked, stones are pelted, their vehicles are damaged, they are only beaten up, then how do we get the word across? Do we need to go beyond government officials, get somebody, a third party? Will that help?
So totally, and Abe rightly raised, one is the NGOs. The NGOs, Tanvi, in spite of the fact that thanks to FCRA and other rules and regulations where the hands of NGOs are tied behind their backs, I am so overwhelmed, and that NGOs across the country, even the NGOs that are not health NGOs, because they understand the vaccine hesitancy. In fact, Abe and I were in a meeting yesterday discussing this, and people from the grassroots were saying it's vaccine aversion. And I think the government has to smell the coffee and understand that. And this is not the place to send ashas who are totally unprotected and who they're not even protected with any protection in terms of gloves, masks, etc., given by the government. But panchayats are a very good combination along with NGOs who are all working, even if they have no health background. Collectively, they go, these are people who are trusted. One thing about the NGOs is that NGOs are respected and trusted in the communities. So the government could combine the efforts, one, and then the material. So these people, then the local, where the local, I'm not saying MLAs and MPs are necessarily trusted, but they have to demonstrate and perform over here. So what is the role they can have? I'm sure there are their constituencies at least they can work with, if not the whole village. Third, the local self-help groups, apart from PRIs, can be involved, but these people also need to be ANMs. They need to be strengthened with the right information. One is the communication at the community level, which has to be sensitive in local language, simple. It should deal with the myths and misconceptions that they're dealing with. But the second is that we need to do micro planning. Let's learn and remember what happened, how we did successful polio campaigns. The polio campaign, let me explain, the greatest strength actually of our vaccination is outreach and mobilization. If you look at what happened during polio and other routine immunizations that we do, which have both been very weak in this case, we need to bring back the lessons in eradicating polio campaigns and efficient supply chain delivery, which also Abe referred to. If people are not going to go far and then return because the vaccine wasn't available. Second, there is a lot of confusion because, people who have been diagnosed, the tests show that they are positive, but many governments, as you know, have asked to show lower numbers, have asked testing facilities not to tell them that they are positive. So people are dying, and if they got an injection, one person dies and the impression and information and misinformation spreads as a whisper campaign across villages, states, and districts. Let's take the example of family planning. Why don't people use family planning methods? Because with ease, because there's a hesitation, there is a fear because of management of side effects. And since there isn't the trust that people have in the health system, which has got further eroded, and in fact, it has got completely eroded in the last 1 month, tragically, and rightly so, and understandably so, where people don't believe if they did have side effects from injections. Everybody knows bukhar aata hai, fever does come. If not, people here are believing they'll die. But fever aata hai, they don't have the faith in the system that their side effects will be treated. So there is that fear, and I think that fear can't be overcome overnight, but we have to understand that when we are doing our behavior change or communications with people. And my earnest, urgent plea to the government is to do away with this damn pre-registration and the top-down communication. People cannot deal with this app. How can you expect people in the villages or even in small towns or the poor and the underprivileged who do not have smartphones in the cities? There are many people who have smartphones but don't know how to download an app and register. So this COVID, I just don't understand how we got everything wrong in our policy. From a national program, it became a state program, it became political. The pricing issue.
Correct, but because it's such a vast topic, let's just stick to what we really are addressing here and focus on that.
I'm talking about vaccine only.
Even within vaccine, so many. We find one aspect every day to discuss. Mr. Sudesh Verma knows it very well. Dr. Tanvi Shukla is often on those conversations with us. But Mr. Sudesh Verma, this is a big challenge. And as two different experts are telling us, perhaps not something that can be just left to a couple of local officials or ASHA workers. We need to have a proper strategy to make people aware and tackle fake news as well.
Yeah, very true, Tanvi. There's no doubt about that. What the experts say, that is the reality of our country. We have, more than 6,60,000 villages, 741 districts. Is a huge exercise. And in the remote villages, if you go, if you've seen, a primary school, that would not inspire confidence. What to talk about the primary health care center? They are being built, but it will take some time to reach every nook and corner. And I have myself seen that the villagers, they trust their local doctor who is not qualified, is not an MBBS, but he gives them a tika. They call it tika. They say that tika le lenge sab kuch theek ho jayega. They have more trust on that individual who is not qualified to be a doctor, and we make a lot of fun of these people. Unless these people are taken into confidence, unless local leaders come up to inspire confidence, rather than questioning the vaccine, rather than trying to put question mark on everything what the government is doing. Finally, we have to reach there, and it's a combined task of all of us. How many celebrities have come forward, because they are the icons of society, and there's the time that they must come forward, they must demonstrate, they must talk to people, and that is the only way to reach them. You see, our elected representatives also, they have a big responsibility, because we have elected representatives up to the level of panchayats, isn't it? So all these people have to band together, irrespective of political ideologies. It's about giving vaccination to every citizen of the country. We can understand that they fear administration. That's the biggest tragedy here. An administrative official, if it's seen, people, I'm talking of remote villages, they run away, fearing that they would be landing in some trouble. So for inspiring confidence in that, we have to rope in all the resources we have. I completely agree that NGOs have to be roped in, community leaders have to be roped in, and that is sadly the situation in our country. I can go on shifting the blame to other parties also, and the parties can put blame on us, but they should look inside and figure out that why this is happening.
Yes,
It's not that,
So
yeah,
who
please.
does that? Who does that, Mr. Sudesh Verma? We've been 5 months into the vaccine drive. Nothing seems to be helping on ground. Now, individual states, one would assume, has the responsibility. The center came out with one guidance brochure in January itself, but clearly it's not working on ground.
You see, every state government has to shoulder this responsibility, irrespective of the party that is in power, because they can tell the panchayat level elected representatives to participate in this campaign. It should happen in the form of a campaign. I know that how villages are scared, and you know what they say? They are saying, "Sir, हमारे यहाँ तो है नहीं कोरोना, हम लोग इंजेक्शन क्यों लेंगे?" They are so scared of injection. So it's our task to educate them, to tell them that this is for their life. And of course, corona injection, vaccination is a different kind of thing that, a lot of precautions need to be taken. Then people have to be kept at the center so that there's no adverse reaction. Then if there's adverse reaction, then that should be taken care of. We need to take them into confidence. And of course, the government is trying its best, and I'm sure the governments will be successful.
Let me bring in Mr. Satyaprakash as well on it. Mr. Satyaprakash, obviously many instances across the states. I was reading one example that's coming from Bihar, for example, where people resorted to pelting stones. Now, their fear is forcing them to resort to violence to chase people away. How will you get through to them, convince them COVID is real, COVID is claiming lives, and the only way to protect yourself is via a vaccine and a mask?
In Bihar, Jivika Didis are playing vast role in getting vaccinated the people in the villages basically. And, even around 700 Tika Express vans are moving around villages to make them aware the vaccine are safe. One has to now understand, I am agreed with Abhayji, Poonamji and Sudeshji that we have to do more. But when it started casting doubt on vaccine, the two senior leader of the Congress party, Mr. Shashi Tharoor and Jairam Ramesh started this. And when vaccine came at the first point of time, the opposition party start making, doubts that why the Prime Minister of India is not first time getting vaccinated. The policy was to give the health workers, to vaccinate the health worker first, at the first stage. That casted doubts in the minds of the people of India, and that has to we have to work together to, do away with such kind of situation, and we have to remove those doubts from the minds of the people of, at least from the villages. Now, at least on this occasion, on this issue, every political outfit, first of all, unitedly appeal to the people of India that don't panic, the vaccine is safe. In one line, it should be the duty of every political outfit. Then we can go to the village level politics and elected representative of village level. Then they will be aware of our own, principle and our commitment towards vaccination. They will have the faith then. When the senior political outfit start making so many allegations, tika par tika tippani, that, contributed in casting doubt over vaccination, that they may be die.
Mr. Satyaprakash.
They may be die.
Mr. Satyaprakash, no offense to Anshul Avijit who's sitting here, but do you really believe that the people of India take every word spoken by Congress party or any other opposition party so seriously? If they believe, let me finish. If they actually believed what Rahul Gandhi had to say, they would truly believe that demonetization was a failure, that we have a bad policy with Pakistan and China, that we are losing territory to China. They would believe that economy is down in the dumps because of Modi ji, and they would have voted BJP out of power in every state. So I think you are giving a little too much credit to your rivals to say the vaccine fear is because of them. Now, by this logic, let's take Rahul Gandhi, make him the brand ambassador of the Tika Karan, and let's take him village to village. Why don't you do that?
You are comparing two different issues. Vaccination directly affect the people, and demonetization is something which affect the complete society.
Economy does.
You have put your question. Let me complete. When you cast doubt, then definitely this is related to vaccination. This is not related to that your money will be drawn from your bank account. But if you cast any doubt related to a medicine and vaccination, people have doubt. Why senior leader of Congress, Shashi Tharoor and Jairam Ramesh started making such comment over vaccination? Why at that point of time it was made a comment that why the Prime Minister cannot vaccinated at the first stage, when the health worker was at the first stage in the policy? What I am trying to say, that it is the responsibility of every political party to appeal. Do not cast any doubt. Unitedly appeal to the people of India that get vaccinated. It is the safest vaccine.
Okay.
Why this is not so?
Okay.
This is my appeal.
Okay. Anshul Avijit, you've heard everybody out. Go ahead, please.
No, I mean, Mr. Satyaprakash has turned this into a very unsavory political slugfest. Clearly, there's a guilty conscience here. He doesn't know what to answer for. All his words and all that emotion, just simply reeks of incompetence and failure. I mean, it was actually the government, if I can say so, which showed political hesitancy by not ordering vaccines at all the whole of last year. The question of hesitancy only comes whether there are enough vaccines to give to the people. Only then people will be hesitant or will refuse to give vaccines. So throughout of last year, the government never ordered any kind of vaccines. They were insistent on that. There are no vaccines now to deal with. All their estimates and projections are highly optimistic. The Supreme Court has actually, cast doubt and skepticism over all their claims and everything they filed in affidavits.
Are we discussing
the
this?
Has called it manslaughter, by the way.
I mean,
the most kind of silly indictment of this government.
What are you saying? If you bring the whole gamut of issues, then I have many things to talk about.
No, I don't want to. Anshul, let's come back. Let's come back to this point. Like you rightly said, let's not politicize it.
Yeah. I now have dealt with this unsavory sort of intervention by Mr. Satyapal. He has no choice. I mean, his backs are to the wall. He's going to say this. I'm going to expect it. But coming back to the point, it's a very serious discussion. And I'm glad you're having it because, it's not something as before me. It's not something that we've not encountered before. There has been vaccine hesitancy in the numerous programs. Now, the silver lining is that all these programs have actually been successful. So we have managed to surmount the vaccine hesitancy that has occurred in the fulfillment and the culmination of these successful vaccination programs before. Now, there is a difference between vaccine hesitancy, I would say, and vaccine refusal. Vaccine refusal, maybe to do with vaccine phobia. I think there are a very limited number of people. Vaccine hesitancy, I don't think the data is not before us. I don't know what is the who are vaccine hesitant, but I believe they are fence sitters and they can easily be nudged towards taking vaccines as long as the messaging is right. We come to a very important thing about messaging. Here, actually, the courts have shown an exemplary response, particularly the high courts, to auditing the action of the executive here. I
Yeah.
think the court.
No, but what have the
also
states
points
done? Let me
the
ask you,
messaging.
can you give me one example, Anshul Avijit, from Punjab to Rajasthan or Chhattisgarh? I was just reading series of incidents of violence that have happened in Chhattisgarh over vaccine fear, similarly pushing back the officials. What are the states doing about it? If you can give me one example of the initiatives taken by any of the Congress-governed states.
No, there's a problem of hesitancy, as seen by reports in Barabanki. I mean, these pictures are they're half comical if the situation wasn't so good. People jumping into rivers. The problem of hesitancy is a pan-Indian problem. We've seen it in past vaccinations before. All your stories, in fact, tell us that they exist in every corner of India. There's one from Vaishali. There are examples from Chhattisgarh. There are examples from Rajasthan, Maharashtra, Madhya Pradesh. Karnataka has a huge problem, as your story suggested, in Mysore, in Belgaum, in different places. In the Congress states, the health ministers have told the workers to decentralize the process, specifically target women. Now, the targeting of women, because there is a gender inequity here, the targeting of women and making them allay their fears about infertility, menstruation is an important part of the Congress program in these states. Also, women are more likely to be victims of this kind of digital divide. The fact that they are less likely to be digitally or technologically friendly. We have to overcome this kind of digital divide by, diversifying our messaging. Now, what kind of messaging doesn't help is the kind of messaging that is coming from the government, in which cow urine is suggested as some kind of a prophylactic remedy, even worse, as some kind of absurd cure for here. This kind of buffoonery, which is coming from the highest quarters of this government and from all lawmakers, has to simply stop.
Okay.
It's just ruining everything. I mean, I'm not even critiquing Ayurveda here. I'm not offering a normative position on whether Ayurveda is good or bad. But what I'm saying is this is not a contest between ancient traditional medicine and modern science. When people are dying,
but when you make it about that, when you make it either or, when you resort to certain age-old beliefs and you replace the modern science or the vaccines, then it's a problem. Sudesh Verma can respond, and then I want to go back to our experts, with a couple of specific points. Yes, Sudesh Verma.
Yeah. Tanvi, you see what Satyaprakash ji said has grains of truth in it, because you see, even in the, I'm talking about educated class, even among the doctors, medical professionals, all of them did not get the vaccination, isn't it? Because of their own reasons. It's not that they all accepted it. And people were talking of whether the vaccine is halal or it is haram. I don't know what kind of arguments were going on. And of course, Congress did everything to create problem, put a big question mark on the vaccination drive. And what happened in Rajasthan? Vaccines were dumped. You are quoting courts and all that. That will answer to the court. That is not a problem. Courts are also trying to, add to the entire issue so that we have a better vaccination policy. Nobody disputes that. But is it trying to take it as a fig leaf and to attack us rather than trying to support? Tell me, when did Mr. Rahul Gandhi get vaccination? I'm not saying that if he does that, everybody will accept that. Of course not. But at the same time, negative things travel very fast. There's no doubt about that. And the kind of social media that is there, people say people will get impotency, people will get corona if vaccine is given, people may die also. All these things, rumors. Who spread these rumors? We are the ones who always spoke in favor of the vaccine. See our leaders, they came out openly, took vaccines and flashed the photographs also. Tell me how many leaders of the Congress did it. This is your responsibility also. You don't just leave it to the Congress to do, the government to do that, isn't it, Anshul? So my question is that let's all band together.
This is a cultural problem about vaccine hesitancy. You're not making it any right.
That yes, vaccination is something good. If Anshul Abhijit takes tomorrow vaccination and tells people that I have taken, people will have more trust. The people who trust your words, isn't it? So we should always spread it rather than trying to attack. You can score brownie points. It doesn't matter to us, but let people of this country get vaccination. Let's spread positive message.
Okay, so now I'm going to request the political representatives to not make this a political conversation. Let's just be extremely honest to ourselves. This is not because Rahul Gandhi said it is bad, or Shashi Tharoor said it, or Jairam Ramesh said it. It's also not because a few doctors showed hesitancy in the first few months when data for certain vaccines was not available. It is an inherent problem which is this time being further magnified and intensified because of all the WhatsApp messages that do the rounds. It's so easy for people to get this, one simple message is enough for a village. But Dr. Abhay Shukla, when we were researching, we came across this example of a village called Janefal in Maharashtra, where it's a very small village, about 60 people who were eligible before it opened up to everybody above the age of 45. There were 60 people who were eligible, and the local administration managed to vaccinate everybody. As of April 27th, they had achieved 100% vaccination because for 3 months, January onwards, for 3 months, the local officials, the local medical official, the police department, all of them worked together to convince people. In fact, they went themselves and said, look, I am taking the jab. I am also getting my COVID test done. I am taking the jab. Now you come and do it. It has to be something like that. And we need involvement from top to the most local official there, Dr. Shukla.
Yeah, I fully agree with you, Tanvi. And we have other examples also from Maharashtra. We have examples from Amravati district, where in a tribal area, in Melghat area of Amravati, the local tribal project officer realized that people don't even understand Marathi. They have their own tribal language called Korku. So she made videos in Korku language and went village to village. The team fanned out and showed these videos in the local language, talked to people, and now those villages have 100% COVID vaccination. So the point is, vaccination is a part of primary health care. And if primary health care is weak and people don't have faith in your primary healthcare system, they will also not have sufficient faith in their vaccination. It's my hunch, and I'm not being political at all, but southern states like Kerala and Tamil Nadu, which have strong primary healthcare systems, have less of this problem, irrespective of the political leadership. If you have strong primary healthcare, which every day it reaches out to people, touches people, people have faith in it, people go to that PHC and see it is open, it's working well, they see the ANM coming to their village regularly, and they see it functioning, then they will have a greater faith. I think this is also a wake-up call. We have to strengthen primary healthcare services in rural areas, across the countries, across party lines. I would appeal that the central government and state government should together launch a large-scale social partnership in every state and at the central level. Take this up as a partnership, form joint action committees, include NGOs, CSOs, civil society organizations, and at the lower level at panchayats, and say that this is everybody has to work together. Stop restricting NGOs, stop placing various kinds of constraints on civil society organizations, encourage them, and of course social groups, and let us make this a national kind of a campaign with widespread partnerships, and with also in mind we have to strengthen primary health care, restore people's faith in the public health system by making it much more effective, not only for vaccination, but for all kinds of health services. That is the way to go. And today and tomorrow, that is what is going to serve public health in this country.
Yes, in fact,
to make public health
I want to build on that. And Poonam Mutreja, how many examples do we have today of any state or district administration really using all mediums available? Not a couple of instances that I gave or Dr. Abhay Shukla gave, or others that have been reported about loudspeaker announcements, but an exhaustive communication via videos, via radio, via camps, regular camps, weekly camps, conversations, door to door. I haven't heard about it at all. I mean, I don't know if there is any information that you can share with us on that.
Tanvi, you are so right. There is none. Each has, and this can only happen if district collectors are given the authority. One thing that has boomerang is this top-down national approach to COVID and especially vaccination. We need to involve, it's a management issue, it's a communication issue, and it's getting your diagnosis right issue. Diagnosis, I'm not talking about the disease, I'm talking about diagnosis of the problem. What I'm hearing on your show from all the political leaders, I mean, if their diagnosis is that these three people, I doubt if anyone knows about Jairam and Shashi Tharoor in the tribal areas and villages. They probably never heard their name. And these are national level leaders who don't have a grassroots recognition or voice. I don't mean to criticize them. I'm just making a statement for the purpose of the diagnosis. So if we don't get our diagnosis right and say these political leaders are responsible and the doctors who did not take the vaccine, first of all, it really upsets me when doctors are attacked on this. And you were right, Tanvi, they did it when they were questioning, when we didn't know enough about the science. We were asking questions on the science. We were not questioning the government, those people who did. We had to understand that these are safe medicines, safe vaccinations before we take them. And that's what most of us have done who have access to the science. So we have to get a diagnosis right. What is the problem? It is a pan-national issue. It is an issue of, there has been vaccine hesitancy, even polio, even today, for routine immunization, there is hesitation, but now we have in front of us hesitation, we have fear, and we have rejection. So we have to look at all these three aspects and develop a strategy. We will never get the strategy right if we keep doing blame game. Finally, I'd like to say that the myths, fears, and violence surrounding vaccination drive has to be dealt at not only the state level. I agree with Abhay, you have to begin state level, some kind of coordination committee, and he's got all the characters right in that, NGOs and others. But we also need to have committees at the district level and then block level.
Yes.
And the district magistrate has to be the coordination committee for vaccination, and vaccination should be his or her priority. And the government has to give those orders. Government has to give the clues. The government and planning. You know, there are people who have the experience both in the health sector and in the administration of India. In the absence of us being able to even think of one example, there are people with experience, and of polio and other vaccines, let's get them out and work with, do a plan with the government at for districts. And the messaging also we have to recognize, and I will be the first to recognize, I've done enormous amount of messaging, but it is not what is working for vaccine hesitation at the village level. We all have to go back to the drawing board and change our strategy and get it right.
Yes.
The media approach for vaccination has had very little penetration in rural areas at this point of time, leave alone small, and also in small towns, leave alone large cities. And I would like to say that our campaigns have to be not only in local languages, simple, and deal with local problems. And finally, you know, we have this very big resource who collectively at the village level, not just ASHA alone, but the three, I always call them triple A's, the Anganwadi, ASHA, and ANM. We have to train them to deal with we have to give them communication, information, skills, and materials for where they can adapt local issues and go to their communities. And panchayats have to take a really big responsibility in convincing people about vaccine. And then there have to be role models we have to identify. If there is a local film actor, local singer who people respect, they have to be brought in. And I don't believe most people will say no. Most people are likely to say yes, but we have to open our doors for people to come in, not just NGOs, but others to come in.
Yeah.
And collectively work. Unless we do collective action, we are not going to be succeeding. And final point that I want to make is there are people willing to get the vaccine. Let's get them the vaccine and simultaneously work on those who are hesitant, fearful, reject, and there'll always be people who will not get it done. But I think convincing, working, focusing on a large critical mass that will get vaccinated will automatically have a positive impact on those who are hesitant, and fence sitters definitely will come in very
In fact,
quickly.
I will, to what you said, yes, to what you said, I will go back to the Janefal example, because that village had the only primary healthcare center for 16 other villages. And when people began to hear and, find out that that village had got everybody vaccinated, it just kind of, helped spread the word and get more people vaccinated. Mr. Satyaprakash wanted to make a point, but before I go to him, Mr. Sudesh Verma, so Anganwadi workers, Asha workers, even the ANMs that, Poonam Mutreja mentioned, yes. But you made a point about celebrities. Why don't we, at the government level, rope in some of the celebrities and take them? If these celebrities can go ahead and campaign for politicians during rallies, why can't they be taken now to the villages to spread the word?
By the way, they did it for polio.
Yes.
Tanvi, it's already happening. It's not that it's not happening. And while, you're true, we all are discussing that. I entirely agree with what the panelists are saying. But at the same time, there are bright spots also, where entire village has got vaccination done because of efforts of village elders. So there's no need to panic. Yes, of course we need to address the issue where it exists. We need state governments to not to force, but to educate people, and this can happen only by example. So all community leaders, including politicians, must come forward and give their examples. If they start taking vaccination publicly or allowing their family members to take in front of the village, of course, this is going to work. And India has always responded to the crisis. Any news which you are flashing, of course, the government will respond to the crisis wherever it happens. Of course, all things will be taken into consideration, all those what have been suggested. I just appeal one thing, because Ansul is there, all parties are there. Let's not politicize vaccine or vaccination drive. There will be enough time to do politics. Let people get their vaccination. If we go wrong, please come. Government is accessible to you. Please tell the government. Don't make politics out of it, because we are endangering lives of people. I sincerely appeal to all the political parties. Please, let's not do politics over vaccine.
Okay, Mr. Satyaprakash wanted to make a point. Go ahead, please.
Yeah, agreed. Since very long, we have been advocating that we should not indulge in petty politics, on vaccination, on pandemic. But all superstitious belief, every kind of social evil has been fighting by the political and social leader. I am fully agreed with Poonam ji that every tools, every kind and every section of society do contribute to make them appeal and show them that vaccination is safe. I am fully agreed with this method, and the government, especially in Bihar, is appealing through the Jivika Didi, and every kind of committee is there to appealing to the people who are afraid of this vaccination or refusal of vaccination or hesitancy, any kind of thing. We have to deal with it and we have to move with it. It will take definitely a time, but at the same point of time, the government of India or every state is fighting with corona and together with getting vaccination drive as well. So two things are going on the same track. So we cannot take them, celebrity to village, because there is so many lockdown in so many states. What we can do through pamphlet, through appeal, through media appeal, everybody should appeal. Whosoever are responsible civil society citizen, they must appeal to their village. Suppose I belong to a village, I should appeal to my village, get vaccinated. And it is the duty of every politician. When some politician, what Poonam ji said, though nobody does know Sasi Tharoor, but people know Sasi Tharoor. They are spreading rumors. Suppose a inspiration go to the Tiruvananthapuram. If somebody knows Sasi Tharoor, he may be, spreading rumors, doing politics. I appeal with folded hand, no politics at all. Not at all.
Okay.
Appeal to the people unitedly. Why all political parties do not sit together to appeal to the nation? Vaccination is safe. Let's get vaccinated. There should be a single slogan.
Okay.
So
I
have
also
no disagreement.
Okay, fine.
Yeah.
I take your point about that, about celebrities. The other aspect is, which the experts also pointed out, you do need the civil society. You do need activists. You do need NGOs to come in and play their role.
Definitely.
You know, they have all different kinds of ways. Some of them actually make folk songs about it, design street plays around it, and that's how they spread this information in small villages. But Mr. Satyaprakash, with the new set of rules and regulations and tightening of the norms, the big question that is, where are these NGOs? And do they have the bandwidth and the money and the people anymore to actually go and do this? Aren't the governments now, missing that support from the NGO system today?
No, government has appealed to the every section of the society. Definitely, government should take the help of all NGO and civil society. We do not hesitate to. When we in Bihar have put every Jivika Didi on this jab on vaccination drive, it simply means that we are very much serious. First time in India, there is a Tika Express. Why other state is not coming out with the Tika Express? Express may have certain kind of videos and every kind of thing that in every village to spread the awareness. We are only related to the awareness. Even if though we fail in awareness, we have to apply another methodology to make them aware. And we will be successful in that. The nation has to be successful in that. We are not in favor of whatever, any suggestion coming out, we are taking those suggestions in consideration and we are working on that. It is not that the government is avoiding every kind of suggestion. It is not the reality. Government is accepting all suggestions from every section of society and civil society and NGOs. They should, on their behalf, even work together with the government in every district. There is no, any kind of hurdle that they can't work together with the government. Now, the corona pandemic at the same point of time is going on. So there may not be large amount of organization working in that sector. So it is the responsibility of the government of the day of any state that they make them aware to get vaccination drive go on, and it rises, as per they are going in different villages, even they are making
Okay, let me take this point to Sudesh Verma as well, and then to Anshul. Mr. Sudesh Verma, would you like to come in on this? The burden is bigger on the governments this time around because we pretty much choked out most of the NGOs. Mr. Verma, I think you're on mute.
Yeah. No, it's not correct, Tanvi. I must correct that impression that we have choked out in the NGOs. No, not at all. Those NGOs that were not following the law of the country and that they did not follow the tax regime, that they did not follow the transparency regime, they have been blocked. Not the NGO. There are lakhs of NGOs working in this country, and the government is working in tandem with them. Even in the corona crisis, a lot of NGOs have come forward and they have tried to help COVID patients. So it's not that the country is working without NGOs. They are there. ASA workers are there. The entire country has a system. The administration is able to reach every village. It's just that we should have the determination. It's a question of persuading people that this vaccine is for you, for saving your life. And that is what we'll do.
Okay, Anshul Avajit, final comments from you on what can be done and how do we increase participation. Now, one option is, in the absence of NGOs and activists who would have been there, who people would have known in village to village, it's up to the district collectors and the district magistrates. They need to get out. They need to be on the road. They need to be visiting there every day with their teams, create task force teams that speak and interact with the villagers on a daily basis. But how do you tackle the misinformation and fake news then?
No, I think that we've reached some kind of consensus here, and I accept Mr. Sudesh Verma's peace offering here, except particularly for this debate. As for Mr. Satyaprakash, he remains as virulent as ever. I just want to tell him that he should stop people who are sabotaging this vaccination mission. I mean, for God's sake, the cure for hypoxia is not a refreshing glass of cow urine. So stop this nonsense. I mean, this has to stop. This is the first message.
No.
The other message which has to go. The other message that has to go. The other messages that have focus on women. There has to be a public trust that has to be evolved over here. The other thing is, in America, they've had a deeper problem with vaccine hesitancy. It's a point I wanted to bring up. They've tried to overcome that in many ways. In fact, it's far, far deeper. If you watch CNN programs, that even here they've started talking about that 5 months back, and it's not even related to some kind of myth or superstition. It's related to kind of violations of individual sovereignty. So they've got different problem here. One of the ways they're tackling it over there is to take the vaccine to the people over there. So make it convenient for them to get the vaccine there. The other point about celebrities and all is absolutely well taken. I think that we need credible voices. We need influencers. We need local support here. We need local people, local women to help out in the process of vaccine distribution. We also need culturally specific messages, messages that may be relevant in Maharashtra, may not work well in other parts of, say, tribal India, which are dealing with other set of cultural issues rooted in historicity and other things. So get culturally local messages there and be truthful. I think be truthful to the side effects of vaccinations, that it can result in fever, because what that is doing is spreading a lot of misinformation
Correct.
about fertility, impotency, and other things. So truth is important. The correct messaging is important. And I think the courts here can mediate. I think the only people that the government is listening to at this point, or the governments of various states as well, are the courts. And if the courts mediate and tell the government, tell the various agencies, listen, get your messaging in order,
Right.
as they have done in all aspects of this vaccination process, I think we'll be a long way in having a successful vaccine. But you know, a successful vaccination program is only successful if there are enough vaccines. I don't know if how is that going to materialize. That's a huge challenge in front
Well,
of us.
I know you say, Anshul, the courts have mediated or intervened, but actually at this point there are just questions and more questions. Even the orders are about more questions, as the courts are still trying to find out the information from the government. So they're actually yet to come out with concrete orders on what to do on ground. And I'm not too sure when that will happen, but I get your point. At some point this needs to be get done, and we need action on the ground by the local administration. I'm running out of time, but Poonam Mutreja wanted to make a quick point. Yes, the final word to you.
No, I just wanted to say to Satya Prasad ji and others who didn't get the point on NGOs, it's not that the government is inviting us at this point of time to come and join their efforts. And we did join the government efforts in the first phase in March onwards. But between March and now, it is not the erring NGOs who are being punished. All of us. There are new rules which are tied our hands, where at this point of time, we can't even get the money that people want to give us, because our bank accounts, the new bank accounts they've asked us to open in State Bank of India, I can't go into details, but there are so many hurdles for NGOs where right now we're working, many of the NGOs in the field are working without money. And in fact, many NGO leaders have died because they're working in the field and have got infected. But there is no money, and there's a huge problem. The government has to come forward. We are not even saying don't do the new FCRA rule. All we are saying is postpone it by 6 months so we can solidly work for the next 6 months with the communities and with the government. All of us want to work with the government, because at the grassroots level, we know it's a life and death issue. So we have appealed to the government many times in the last 2 weeks at all levels that the Home Ministry should postpone the new rules, which obviously will create chaos and are creating chaos.
Yeah.
They're very complex, very complicated. Let's postpone that for 6 months. Is all we are asking.
Okay. Maybe another day we will have a detailed conversation about this issue. Not today, completely out of time, though. Thank you so much to all 6 of you for joining us on this conversation. I think this is an extremely important issue. You know, and this isn't just a first world problem of vaccine hesitancy that stems from some misplaced sense of privacy or sovereignty or propriety or whatever it is. Or yes, some people will always have doubts. Yes, some people will always don't see the need to get a vaccine shot, which is each to his own. But when it happens because of misinformation, when it happens because of fake news, when it happens because of misunderstanding of the current facts, because of lack of awareness, then it is our responsibility Our responsibility is to get the right information to every single person in our country, to get the vaccine to every single village in our country, make it accessible. And then the people can decide whether in the cities or in the villages. But to let them be in that information black hole where they believe the vaccine will kill you, that it's a government conspiracy to harm you or your health, where they see somebody who got a vaccine getting fever, and that's their inference from, oh, this is what is going to happen, where this vaccine shot will make you impotent. That's such a big issue in our villages right now. Those myths must be busted, and people must be put at ease about the vaccine, its side effects, and longer-term benefits. And this starts from the top, where it goes to the last mile, till the local district administration and those officials. It's going to be a long, drawn process. We should have started months ago, but it's still not too late. Thank you so much for joining us.